Hello, my name is Abdullah Bashir. I'm a doctor working here in Sierra Leone. I'm standing here in Freetown outside of Connaught Hospital, which is the national referral hospital for Sierra Leone and the biggest in the country. I'm working with King's Health Partners here, and this hospital serves as the centre for our partnership, and we are working with the hospital to improve services. And this is where I work every day, and I'm going to show you around and show you what it looks like. So we're standing here in the main reception area of the hospital, and this is where a patient will come straight to the main entrance towards the registration room, which is just through here. So patients will come here to register before being seen by the doctor in the emergency area, and they'll pay 15,000 leons, which is about £2.50, and they'll be seen. Pregnant women, under 5 children, and women who are currently breastfeeding are exempt from medical costs, and won't have to pay any admission costs or any treatment for medicines from the hospital. So after the patients have paid their registration of 15,000 leons, they'll be sent to the waiting area just outside the OPD room, the outpatient department room. So this is the waiting area for the OPD. As you can see, it's only 2 benches in a very small space, so it can become a little bit cramped. But patients wait here very patiently before they're seen by the doctor, just inside. So this is Nurse Rebecca. She is a nursing aide working in the outpatients department. She works here in the day shift, and she runs this show here. And this is where I normally work day to day. As you can see, it's quite bare. There's only a desk, a couple of chairs, and an examination couch. There's no other equipment here to diagnose a patient, to check what their vital signs are. The doctor has to bring their own blood pressure machine, own thermometer, own gloves, and there's no medications available here to give to the patient, as well as other consumables such as IV cannulas or fluids. So unfortunately they're very sick, but we can't really do anything for them in this room. So we're just going into the trauma room now, which is where new surgical admissions normally go to, or any patients who have been in a trauma. Unfortunately, there's no clear criteria of what kind of patient should end up here, so it's not always surgical. So I'll show you the area just over here, which is where they can do basic dressings. As you can see, they only have really basic equipment, often not the most sterile, so they have bits of gauze, bits of iodine for cleaning. But as you can see, it's not the most clean environment, so there is always a risk of infection. Patients often come to this surgical ward admitted as an emergency. They're often not seen for a few hours, and occasionally it may be over a day until they're seen by a more senior doctor, so that can cause serious delays in the treatment of the patient. So the sickest patients in the outpatients department will be taken out of there, usually on a stretcher, and wheeled down towards here, towards the intensive care unit. You can see that they'd have to be wheeled through on a stretcher through a very busy hub of activity. Lots of people can see. It can often be raining, like it is today. So this is the intensive care unit, and this offers the patient the best treatment that the hospital has. It's still very under-resourced, but there are more nurses here who provide more support to the patient, monitor the patient more regularly, and there are a few more consumables such as cannulas and needles and syringes that can be given to the patient. So there are 2 separate rooms, both making up 9 beds in total. We can have a look inside one. There's only 1 senior doctor working here full-time in the ICU, but there are many nurses also working here who are the most well-trained in the whole hospital. So this is the Department of Radiology. Here there are 2 X-ray machines which offer plain X-rays, and also an ultrasound scanning machine upstairs. In the UK we're really reliant on X-rays to guide us on our diagnosis and treatment of the patient, but the reality of the situation in Sierra Leone is that many patients can't afford them, so doctors have to think really carefully before telling the patient that they have to pay for them, and it may be that a patient can't afford to eat for the next week if they get money for an X-ray instead. So it's a world away from the NHS, which I'm used to working in, where you can see all the films on the computer screen and change everything in a click of a button. But here are very rudimentary things which people are working with, but as efficiently as they can. So this is one of the female medical wards. There are altogether 4 medical wards in Connaught Hospital, 2 male and 2 female. So this is a typical example of what a ward looks like. As you can see, it's quite bare, just a few beds in here. There's not much equipment available in here in an emergency setting. Again, patients will have to buy all their own medicines, gloves for the nurses and doctors, needles and syringes, and everything else. So patients on all the wards get 3 daily meals, all for free, provided by our hospital. And here we have the delicious jollof rice provided by our chef. It does look very tasty. It smells very good. And on this floor we have the laboratories. We have hematology, biochemistry, microbiology. And we'll just go and see an example of a lab, and we'll check out the microbiology lab. Here the lab technicians here hard at work. They are able to use a microscope, for example, to look at urine and look for bugs, bacteria in urine, but they find it is quite difficult to get an adequate blood culture. This is where they would bring specimens from tissues taken as biopsies in theatre, for example, and they'll have a look at them under the microscope and try and determine what kind of samples they are. We can see a lump taken out of a breast in a pot here, and they're just kept in little pots that you used to get the old 35mm film in, so they're not officially sterile pots. But you can see it's really improvised with specimen pots here. So we have a Tupperware box, and we have milk powder box and old medication boxes to use to store specimens instead of the regular sterile specimen pots we're used to back in the UK. So we're just walking towards the back of the hospital. You can see here are the toilets that patients' relatives and visitors would use. Many of the patients' clothes and relatives' clothes are washed here and left out to dry. Interestingly, if patients' relatives are coming from far afield, outside of Freetown, then they will often not have a place to stay, so they'll end up sleeping in the courtyard area of Connaught Hospital. And you can see the views of Crew Bay just behind, which is one of the poorest parts of Freetown. Unfortunately, in the area in the back of the hospital, which is still inside the compound, you'll often find a lot of medical waste as well, so dirty needles and syringes on the floor, and gloves and other medical waste. So we're just about to enter the Pediatric surgery ward. So this is a Pediatric surgical referral centre for the whole country. Kids of all ages will come here. And children under 5 will get free treatment, which is an initiative run by the government. I have a big variety of conditions that present here, from congenital conditions from birth to burns, which is actually a very common problem in Sierra Leone and in Freetown especially, where you have a lot of urban poverty, people living in close quarters, lots of open fires, and lots of children running around and unfortunately suffering burns as a result. Seeing how people are able to deal with such difficult circumstances in terms of the lack of resources is really inspiring, and hopefully I can take that back to the UK and learn how to cope in difficult situations. Looking back on my experience, I've been really taken aback by people's dedication to the hospital, and Connaught is in a very difficult position at the moment with lack of funding, no drugs or no consumables available really, but people are still very positive and an inspiration to me. They're trying to take things forward and look into the future and trying to make Connaught Hospital a centre of excellence. So I hope you've got an idea of what it was like just by showing you around. I think it was really rewarding and it was a really unique opportunity for me, and I look forward to coming back in a few years and seeing how the King's partnership has strengthened Connaught Hospital.